Hello, my name is Marsha Greenfield, and I'm a member of the advocacy staff of the American Association of Homes and Services for the Aging. I'm going to talk to our members about the Elder Justice Act. This is posted on www.aahsa.org at our healthcare hub. The Elder Justice Act is not new. It was originally passed by the Senate in 2008, but no action was taken by the House, and so it was then incorporated into the healthcare legislation. This bill addresses congressional concerns about crimes that are committed against older people who are viewed as a vulnerable population. This is similar to child abuse and domestic violence legislation because these acts are most often committed by family or other loved and trusted individuals against someone who cannot defend themselves or who cannot clearly complain or explain what happened. And for elder abuse, this includes financial exploitation as well as physical and mental abuse. Let me highlight some of the studies to be conducted and grants that will be available for service providers and others, as well as the reporting and training responsibilities that are in the legislation. The legislation creates grants for long-term care staffing and programs that will enhance the training, recruitment, and retention of staff, and these will be available to providers in both long-term care facilities and community-based long-term care. There are grants to provide training and technical assistance for management as well. And there are grants to help facilities pay for electronic health records to improve safety and reduce adverse events. And there are also grants to the states to improve the training and performance of state agencies and surveyors regarding the investigation and response to complaints of abuse, neglect, and misappropriation of property in long-term care facilities, in response to a General Accountability Office study in 2003 that indicated problems with the way the states address complaints. Finally, the legislation also creates a National Training Institute for surveyors to help them improve their response to complaints of abuse and neglect. For individuals, the legislation requires reporting crimes against residents of long-term care facilities. The same GAO study noted that crimes are not always reported in a timely fashion, and so this legislation puts the responsibility on individuals employed by long-term care facilities to report to local law enforcement when they have a reasonable suspicion that a crime has committed against a resident, whether that crime was committed inside or outside the facility. Now, there is a very specific time frame for these reportings. If it appears that a resident has a serious bodily injury, the employee who notices the injury must report within 2 hours of suspecting that the injury was the result of a crime. If there is no serious bodily injury, then the report must be made within 24 hours. Now, this also provides an opportunity for the long-term care provider to work with the local police and other agencies in the community to provide in-service training to employees and management on how to report, defining crimes, information needed, etc., and to share with police our unique expertise in working with vulnerable elders. I would note that AAHSA members created the first elder abuse shelter within a nursing home, and we will have additional information on our website about this unique program. Finally, the law requires that providers cannot retaliate against an individual who lawfully reports suspected criminal activity. There are stiff penalties to the individual who fails to report and also to the facility if there is retaliation. So it is very important to educate your staff and management and ensure that these provisions are implemented. Two other provisions of the healthcare legislation that I want to mention are the creation of a national criminal background check program and an obligation to train staff in dementia. Now, the criminal background check program will be implemented by states, and it is designed to help providers identify people with criminal backgrounds before they hire them. And the obligation to train staff in dementia is also a requirement in the law, and that again is designed to help prevent abuse and neglect of residents and improve the quality of care that we provide. Again, please check the AAHSA website for additional information, which we will keep updated as regulations are passed to implement these laws. Thank you.